Biote Medical is a company that trains practitioners how to do hormone optimization. If you're tired all the time, if you're gaining weight, if you have low sex drive, you're not sleeping well, you kind of have that brain fog and can't remember things, you could be a candidate. If you're a female and you're over the age of 25, or if you're a male and you're over the age of 30, you could be having problems with your hormones. Those hormones could be optimized by using little small pellets, like a grain of rice, placed just under the skin. But when you go to your doctor, they want to put you on medications, diet pills, sleeping pills, memory pills. Pretty soon your purse is filled with pill bottles. But is that really going to give you a better quality of life? Why take 104 shots a year when you can get pellets twice a year and have better benefits, more stable hormone levels, less side effects? It just makes sense. This all started with one patient. I couldn't get her hormones optimized. So much so that she actually went to another city and got pellet therapy. And I was like, what's pellet therapy? And pellet therapy for her meant that she got her marriage back, that she got her life back. And she said, Gary, you need to investigate this. And I did. I became so interested in it, I started a company and I wanted to train as many people as possible so that we could change lives across the country. And that's what we've done at Biote. I don't really know what natural means, but what I do know is what bioidentical means. Wouldn't you like to have hormone optimization using hormones that were exactly the same as what your ovary or testicle made? No synthetic hormones, no fillers, no things to cause allergies, no things to cause problems later. Pellets have been around for 80 years. They're used in 5 continents. We actually take pure testosterone, bioidentical testosterone, pure estradiol, bioidentical estradiol. Those little small pellets, once compressed, are then sterilized. They're placed painlessly under the skin, usually in the hip. These pellets will completely dissolve and they will produce a certain amount of hormone absorption each day. After 4 or 5 months, those pellets are gone, then we replace those hormones again. After you've been treated, your husband's going to go, what about me? Because I have the same symptoms, and you're going to want to bring him in because we can optimize both of you together. It's really couples therapy. By the way, you'll want to bring your parents in after that. The good news is it's really time to start feeling your best. If you want to feel your best, if you want to have that vitality that you had when you were in your 20s or in your 30s if you're a guy, it's really time to find out, are you a candidate for pellet therapy? Can we help you at Biote? It's time to give us a call, find a certified practitioner who can help you, take the questionnaire, get your lab work done, get your life back. Now's the time.
Hi, I'm Dr. Corey Rice, practicing internist in Dallas and medical advisory board member at Biote. Today I'm going to talk to you about vitamin D, specifically hormone D, combined with vitamins A and vitamin K. So vitamin A, D, and K. We have 2 ADKs, one is 5,000, one is 10,000. These fat-soluble vitamins influence several areas of the body. We live in a world where our immune systems are under attack. And so what we want to do is try to take steps to help protect our immune system. One of the ways we can do that, and one very well-researched way to do that, is to optimize our vitamin D level. But we want to combine that with both vitamin A, which also has immune support properties, and we want to combine that with specifically something called vitamin K, specifically vitamin K2. These 3 together absolutely influence the patient's immune system and your immune system to help you have the most robust immune system that you can in a world where, again, our immune system is constantly challenged. Another influence with ADK is it helps influence cognitive health. It influences bone health. It influences cardiometabolic health. And absolutely, as I said, influences immune health. So this is a head-to-toe intervention. So check out ADK5 and ADK10 today and see if it's the right thing for you.
I'm Christine Topham. I'm 64 years old and I live in Cartersville, Georgia. Well, I found out about Biote through a fellow realtor. We were at a luncheon and I started noticing how wonderful she looked. She'd lost some weight recently and was full of energy, so I asked her what was her secret, and she said that it was the Biote hormones and led me in the direction of the nearest clinic. Well, when I think about prior to taking Biote, I remember just being so tired all the time, also anxious, and I suffered from a little bit of depression, and I had no libido whatsoever. It was a drag because the hot flashes were keeping me up at night, and it was just kind of difficult to get through the entire day. Well, Biote hormones have increased my energy tremendously. I also feel better as far as physically. I have a very strong sex drive now. My clarity in my mind is much better. I don't need as much sleep. I just feel like I'm in my 40s again. I tell everyone that I know. I share that information. I literally would like to stand on top of a mountaintop and just scream out, you don't have to suffer anymore. You can have a great life. You can feel better again. You can have a great life with your husband or whoever you're with, both on the intimate level, but also on the energy level.
I had a patient who was just skiing in a steamboat, and he had a normal ski day and he snapped his tibia. And he found that he was osteoporotic with what most people would consider a normal testosterone level. And after a year of replacement, he had all of his hardware removed, and he is now totally healthy and finding that it's affecting him in many different areas of his life. I see one success story after another and have had families thank me for giving them their wives back, their daughters back. Biote has not only changed my patient's life, it's changed my life and my career.
Hi, I'm Dr. Corey Rice, practicing internist in the Dallas area and Biote Medical Advisory Board member. Today I'm going to talk to you about a compound called DIM, specifically DIM SGS+. DIM stands for diindolyl methane, and SGS+ is an extract from sulforaphane. And these are two very important components that help metabolize estrogen appropriately in the body. So when a patient has hormone issues, oftentimes those issues are from how those hormones are metabolized in the body. And so you can actually consume micronutrients that help facilitate the metabolism of those hormones out of the body. And so this particular product is first in class, first of its kind. And what it does is it helps hormones, both made in the body, but hormones taken outside of the body, to help them go through the body and act on the areas that it should to enhance the patient's health. So if you have any signs of hormone imbalances, check out DIM SGS+ today from Biote.
I had a lady in middle management, and she was having a lot of memory fog. She couldn't remember words. She would lose her train of thought. She was very drowsy, sleepy, irritable, moody, pretty much most of the time at her job, and her job was on the line. And so she came to me and she said, I don't know what's wrong with me, but I need help because I'm about to get fired from my job. And so we tested her hormones, and her hormones were very unbalanced. So Biote is a very important part of my practice, and it has been a life changer for many patients, and not just the patient themselves, but for their families, because some of these patients would come in and they were on the verge of divorce because their relationships had changed. They no longer had a libido, they no longer had energy, their mood had changed, they were irritable. And so having their hormones balanced, all of a sudden these things leveled out and they felt better, they had more energy, their libido improved, and they started trying more to do things in life like losing weight and exercising more and doing things with their spouses and their children. And so it's been a game changer.
Hi, I'm Dr. Corey Rice, practicing internist in Dallas and medical advisory board member at Biote. Today I'm going to talk to you about probiotics, specifically gut health. Gut health is the gateway to immune health. And as you know, many of our immune systems today are dysfunctional, are at risk of certain issues. And so it's important that we give good microorganisms to our body on a daily basis in the form of probiotics to help feed that immune system. At Biote, we have a probiotic called multi-strain probiotic. It's a wonderful probiotic that actually has been shown to restore the microbiome. And that's important as we deal with immune system dysregulation and immune system upregulation every single day of our life. Check out multi-strain probiotic today from Biote and see if it's right for you.
I have an 89-year-old gentleman who came to me who is very frail, and he knew about testosterone. He said, I really think I need this to build up muscle mass. I don't have any muscle mass. I'm weakening, 89 years old. And he kind of came over, stooped over like this. And, he's been doing it for about 1.5 years now. And he says he pays, saves up his pennies because this is the one thing that really, really helps him feel stronger and gives him the motivation that he needs. Doing family medicine, we do everything. We take care of diabetes and hypertension and obesity and all the kinds of problems that people come in with, as well as acute care. And a lot of patients have so many little complaints that Biote actually takes care of. So a menopausal woman comes in with, she's fatigued, she's having hot flashes, she's having menopausal symptoms, but she's also having memory loss, she's having brain fog, she's having irritability, all those kinds of things. And the Biote, getting those hormones back in to balance, really, really helps her and gets her motivated again and makes her feel better.
I'm Christine Topham. I'm 64 years old, and I live in Cartersville, Georgia. So at 33, I had my second child, and during childbirth, I had a complication called a placenta accreta, and went into DIC, which meant basically that my blood would not clot. As a result of that, I had an emergency hysterectomy. I was left with my tubes and my ovaries. However, I never ever felt right after that. I remember telling the doctor I felt like my clock was broken. Prior to having the hysterectomy, of course, you have your cycle. And I knew by the days of the month and everything, and by how I felt physically and emotionally when I was ovulating, when I was getting ready for my periods. And I just felt broken, like I couldn't understand. My emotions were not tied with anything like they were before. I just remember feeling very empty and like there was nothing I could count on as far as my emotional health. It's really simple. Basically, you go to your doctor and they test your hormones to see what you're in need of. Once they determine that, then they go ahead and simply do an insertion. I always tell people that it's not even as big as a rice, a half a grain of rice, and they insert that in your buttocks. And you have a little steri strip on there and you go on with your day. It doesn't hurt, it's great. And within about 3 or 4 days to a week, you'll start feeling the effects and your energy level will increase and all those other symptoms will eventually go away.
Hi, I'm Dr. Corey Rice, practicing internist in Dallas and medical advisory board member at Biote. I'm going to talk to you today about methylation. But specifically, at Biote, we have a product we've designed called Methyl Factors Plus. So methylation, let's just talk high level for a second. As we wander through the world and we eat and we drink and we just expose ourselves to the elements of life, we're going to expose ourselves to things that shouldn't be in our body. That's just a product of living, breathing, and eating. Some of those things can be a little bit detrimental to our health and to our immune system. So it's important that we understand the concept of healthy methylation. Methylation is the process of taking on all of those toxic insults and helping the body process them and ultimately excrete them. We have hand-selected each component of Methyl Factors Plus to make sure that we can optimize your ability to combat any of that toxic insult, but also help promote healthy detoxification. Check out Methyl Factors Plus from Biote today and see if it's right for you.
One of the most moving cases I had with Biote was an elderly woman brought to me by her husband because she was starting to show signs of memory decline. We had done some testing, she was showing signs of early dementia, and I noticed that as she sat there, she would not initiate conversation, which is a worrisome sign in dementia. We pelleted, brought her back, and at the 4-month mark, I'm happy to report that she was initiating conversation. And when we did the same cognitive testing, her scores had actually improved. And I never see this in dementia. I don't see that with the prescription medicines that are available to me. It just speaks to the power of hormone balancing.